The report finds that councils are struggling to implement personalisation for people with complex and multiple needs. I just wondered what you saw as the main barriers and obstacles to making progress in that direction.
Okay. I'd like to qualify that slightly to say that I think councils are starting to refresh their approach to people with multiple and complex needs, and developing the personalisation agenda. And one of the things in part 2 of our report are some really important case study material which show just how exceptional families working together closely with creative social workers can really transform people's lives and deliver people's personal ambitions. So this is not completely a negative story, but you're right to say that there are some significant barriers in place. And we've talked about some of these before in some of our earlier reports, but particularly as they apply now to personalisation. There are issues around commissioning, again, particularly for people with multiple and complex needs, commissioning services which are out of area rather than local services where people are living many miles, sometimes many hundreds of miles away in specialist services. Working closely with providers, we find that councils are using providers to provide the services, but not bringing them in at an early stage in terms of developing and framing the services to respond to individuals. And thirdly, in terms of perhaps what councils are doing, particularly in terms of their own practice, is back to the old chestnut of assessment and care planning. We still find that assessments don't take a holistic view of people, and they're not responding in a personalised way to some of the needs which people are presenting. So there are probably 3 barriers to personalisation, and I guess what our report is saying is that these are early days, and this is an early warning. We think councils need to take account of particularly some of the quality issues that are arising from our quality ratings of services. So when they're selecting providers, when they're selecting services, to be using those ratings to make some judgments about whether that's working for them. Some councils are now saying they won't contract with poor providers, and even for adequate providers, they're saying they're monitoring very closely the provision of those services. We think there needs to be a greater understanding about personalisation amongst staff, amongst managers, and particularly amongst some politicians. We think there needs to be good political and managerial leadership for this to have effect. And again, finally, I guess, the engagement with people who use services. In my experience, and we make a very strong point in the report of saying personalisation shouldn't be equated to direct payments and individual budgets. It's part of the story. There's a bigger picture here. But in my experience, when I've talked to people around personalisation, the engagement of user-led organisations is often what's tipped the balance between a council which does this really very seriously and a council which is still relying on its own staff to, in a sense, to give out the message. Real danger, I think, for social work, that it becomes the lost profession, the lost role. And one of the questions we've asked ourselves in this study are where is the social worker? And I'm old enough to remember, the older days of social work, before care management and case management, and some of the values which social workers held and had, how they worked with and around some of the Father Bistek principles of self-determination and advocacy for people. And I think we lost some of that in our rush to new community care and care and case management. So I think there's the potential for a renaissance for social work here. I think there's a really critical and important role for social work in personalisation. I think it's there because I think social workers understand more clearly the dynamics of families and being safe in their professional understanding of these issues, can move back from that professionalism and use that experience to support people in achieving their own ambitions.